Have you ever looked at your lab results, noticed your creatinine slowly creeping upward, and quietly wondered, I'm eating fruit, I'm trying to be healthy, so why are my kidneys still getting worse? If that thought has ever crossed your mind, what I'm about to share may feel unsettling, but it could also be one of the most important warnings you hear this year. Because here's the hard truth, most seniors are never told for adults over 50, especially those already dealing with elevated creatinine. Some fruits labeled as healthy can silently accelerate kidney damage, pushing your numbers higher month after month without pain, without obvious symptoms, and without giving you a chance to react until the damage is already underway. I'm Dr. Richard Hale, and I've watched this happen far too often. Patients who quit soda, choose fruit over dessert, follow every piece of conventional advice, yet their kidney function continues to decline, not because they're careless, but because no one ever explained which fruits quietly overload, weaken kidneys with potassium oxalates and hidden metabolic stress. And this matters more than people realize because high creatinine is not just a lab value, it's a warning signal that your kidneys are struggling to filter your blood efficiently, a signal that if ignored can move you closer to fatigue, swelling, cardiovascular strain, and even dialysis faster than most expect. But here's the part that gives you your power back. This progression is not inevitable. Once you understand which fruits act like silent saboteurs and which ones truly support kidney protection, you can make small, precise choices that dramatically reduce stress on your kidneys. In this video, I'll draw a clear line by revealing 6 common fruits seniors with high creatinine should avoid, even though they're widely praised as healthy. And just as importantly, I'll show you 3 specific fruits that are not only safe but may actively help protect kidney function. Stay with me to the end because the final fruit isn't just kidney friendly. It may help activate your body's own natural defense mechanisms. And once you hear it, you'll never look at fruit the same way again. The first fruit we need to talk about looks harmless, refreshing, and almost too healthy to question, and that's dragon fruit. I've had many patients tell me the same thing, Dr. Hale. I chose dragon fruit because it's low in potassium, so I thought it was safe. And on the surface, that logic makes sense. Dragon fruit is light hydrating and often recommended in kidney-conscious diets. But here's where the mistake happens, and it's a dangerous one. Kidney stress isn't caused by potassium alone. There's another compound that quietly builds pressure inside weakened kidneys, and dragon fruit contains much more of it than most people realize. That compound is oxalate. Think of oxalate like microscopic glass dust. By itself, it doesn't feel threatening. But once it enters the kidneys, it binds with calcium and forms sharp needle-like crystals. Over time, those crystals irritate kidney tissue, trigger inflammation, and increase the risk of stone formation, especially in people whose filtration ability is already compromised. According to USDA data, just 100 grams of dragon fruit can contain close to 95–100 milligrams of oxalate. For someone advised to stay under 50 milligrams per day, that means a small bowl can quietly double the safe limit without you ever feeling a symptom. That's what makes dragon fruit so deceptive. It looks kidney-friendly on paper, yet it creates a hidden workload your kidneys may not be able to handle. If you've been eating this fruit regularly thinking it's a protective choice, you're not alone, and this realization alone can already reduce stress on your kidneys. But understanding oxalates is only the first layer, because the next fruit on this list doesn't just strain the kidneys, it can also disrupt the heart, and that's where the real shock begins. After understanding how oxalates quietly strain the kidneys, it's easy to think the next danger must be similar. But this fruit operates on an entirely different level, and that's what makes it far more alarming. Soursop, also known as graviola, is often praised in wellness circles as a miracle fruit, and I've met patients who consumed it faithfully because they believed it was protecting them from serious illness. One man told me he drank soursop smoothies daily, convinced he was strengthening his body until his blood work showed his potassium levels climbing alongside his creatinine. Here's the issue most people never hear about. A single cup of soursop pulp contains roughly 620 to 630 milligrams of potassium. For someone with healthy kidneys, that may be manageable, but for seniors with impaired filtration, it can push the body dangerously close to hyperkalemia. Excess potassium doesn't just burden the kidneys, it interferes with the electrical signaling of the heart, increasing the risk of palpitations, chest discomfort, and in severe cases, sudden cardiac events. And there's another layer that makes soursop especially risky. The fruit contains a compound called ananasin, which has been studied for its potential effects on cellular energy production. While this has sparked interest in cancer research, long-term exposure has also been linked in observational studies to neurological damage resembling Parkinson's-like symptoms. This places seniors in a difficult trade-off. Potential antioxidant benefits weighed against serious renal, cardiac, and neurological risks. For anyone managing high creatinine, that balance tilts heavily toward caution. Reducing or avoiding soursop can immediately lower potassium stress and protect both kidney and heart function. But potassium overload doesn't always come from exotic fruits. Sometimes it hides in choices that look almost identical, and that's where the next mistake quietly slips in. After hearing about potassium overload, many people assume the danger only comes from obvious exotic fruits. But one of the most common mistakes I see happens right in the grocery store between two fruits that look almost identical. Nectarines and peaches sit side by side, same color, same size, same sweetness, and most shoppers treat them as interchangeable. I once had a patient who ate nectarines daily, believing they were making a safer choice than bananas, until repeated labs showed his potassium slowly creeping upward with no clear explanation. Here's what was happening beneath the surface. Although nectarines and peaches come from the same family, nectarines naturally contain significantly more potassium. A single medium nectarine delivers about 280 to 290 milligrams of potassium, while a comparable peach averages closer to 180 to 190 milligrams. That difference may sound small, but for kidneys already struggling to filter minerals efficiently, it matters more than people realize. Think of potassium like a budget. When your kidneys are healthy, you can afford small overspending. When they're compromised, even modest overages accumulate into real metabolic debt. Repeated day after day, that extra potassium forces the kidneys to work harder and pushes blood levels closer to dangerous thresholds. The frustrating part is how easily this mistake happens. There's no warning label, no obvious symptom, just a smooth-skinned fruit that quietly carries a heavier mineral load. The simplest solution is also the most practical: choose peaches instead. Their lower potassium content makes them a safer alternative without sacrificing flavor or enjoyment. Run your thumb over the skin. Fuzzy means peach, smooth means nectarine, and let that small habit reduce kidney strain over time. But mineral load isn't the only way fruit becomes dangerous, because the next risk doesn't come from fresh produce at all. It comes from what happens when fruit is dried. When people finally accept that fresh fruit can sometimes be risky, they often make a second mistake without realizing it, trusting dried fruit as a safer, more convenient alternative. I've seen this repeatedly, especially with papaya. A woman once told me she stopped eating fresh papaya because she heard it might be high in potassium, but she felt confident sprinkling dried papaya into her morning granola, thinking the smaller portion must be harmless. What she didn't realize is that drying fruit doesn't remove minerals, it concentrates them. Imagine a sponge soaked with potassium and sugar, then squeezed until all the water's gone. The sponge becomes smaller, but everything inside it becomes far more dense. That's exactly what happens to papaya when it's dried. Even fresh papaya already carries a caution flag with roughly 390 milligrams of potassium in half a medium fruit. But dried papaya takes this to a completely different level. Just 100 grams can deliver close to 900 to 1,000 milligrams of potassium, an amount that can overwhelm compromised kidneys in a single snack. And because dried papaya often appears in healthy trail mixes, cereal blends, and energy bars, people consume it without ever registering how much potassium they're loading into their system. There's no immediate pain, no instant reaction, just a slow rise in potassium and creatinine over time. The solution here isn't fear, it's precision. If you enjoy papaya, choose fresh, limit the portion, and treat it as an occasional food rather than a daily habit. Avoid dried versions entirely when kidney function is reduced. But potassium concentration isn't the only trap fruit can set, because the next fruit on this list looks innocent, tastes indulgent, and quietly overspends your kidney's mineral budget in a way few people expect. By this point, many people start thinking, all right, I'll just avoid the obviously risky fruits, but then they run straight into one of the most emotionally difficult ones to let go of: mango. Mango feels like a reward. It's sweet, satisfying, and often described as nature's candy. I've had patients tell me they looked forward to mango as their one healthy treat, especially after cutting back on processed sugar. And to be fair, mango does offer real benefits, including antioxidants and compounds that may improve insulin sensitivity. But here's where the problem begins for kidneys under strain. Mango carries a potassium load that quietly exceeds what compromised kidneys can manage. A single medium mango contains roughly 320 to 330 milligrams of potassium, already well above the commonly recommended per-serving limit of about 200 milligrams for people with elevated creatinine. Think of potassium like a credit card. Healthy kidneys can pay off small charges easily. Weakened kidneys can't. One mango may not cause symptoms, but repeated over weeks and months, that excess potassium accumulates into metabolic debt-raising blood potassium levels and increasing the risk of hyperkalemia. And hyperkalemia isn't subtle. It can interfere with heart rhythm, trigger weakness, and in severe cases become life-threatening. This is what makes mango so deceptive. It feels nourishing, even comforting, while quietly placing pressure on both the kidneys and the heart. The solution isn't punishment, it's timing and restraint. If kidney function is normal, mango can be enjoyed occasionally. If creatinine is high, it's best to step away from it entirely and protect your filtration reserve. But as risky as mango can be, the next fruit on this list is even more dangerous because it delivers a double hit your kidneys may never see coming. By now, you might feel like you've identified the obvious dangers, but the most deceptive fruit on this list often surprises people the most because it's widely celebrated as a healthy, plant-based alternative: jackfruit. I've seen many seniors turn to jackfruit after reducing meat, believing they were making a heart-smart, kidney-safe choice. One patient even told me he replaced pulled pork with jackfruit several times a week, proud of the switch, until his potassium levels spiked, and his creatinine followed soon after. Here's why jackfruit is uniquely dangerous for weakened kidneys. It delivers a double hit. First, potassium. Just 1 cup of jackfruit contains roughly 700 to 750 milligrams of potassium, more than 3 times the commonly advised per-serving limit for people with compromised kidney function. That amount alone can push the body toward hyperkalemia, placing immediate strain on both the kidneys and the heart. But potassium isn't the only problem. Jackfruit also contains a meaningful amount of oxalates, around 35 to 40 milligrams per 100 grams. That means while potassium stresses filtration, oxalates simultaneously increase the risk of crystal formation and kidney stones, creating inflammation from 2 directions at once. This combination makes jackfruit especially risky, far more than fruits that only pose a single burden. The solution isn't abandoning plant-based eating, it's choosing smarter substitutes. Shredded king oyster mushrooms or young green banana can mimic the texture people love in jackfruit dishes without delivering the same mineral overload. Removing jackfruit alone can significantly reduce stress on your kidneys. And if fruits this popular can quietly cause this much harm, the natural question becomes, is there anything safe left to eat? The answer is yes, but the next shift requires changing how you think about fruit entirely. After hearing how easily certain fruits can overload weakened kidneys, many people reach a quiet moment of anxiety and ask, so what can I eat safely? And this is where the story shifts, because not every fruit works against you. Some actually support your kidneys in subtle but powerful ways, and one of the safest places to begin is with the humble pear. I often think of a patient in his early 70s who felt overwhelmed after cutting out several fruits at once. Pears became his anchor not because they were exciting, but because they were dependable. From a kidney perspective, pears are low in potassium, which immediately reduces filtration stress. But their real strength goes beyond mineral content. A medium pear provides around 6 grams of fiber, much of it soluble fiber, which helps lower LDL cholesterol and calm systemic inflammation. This matters because the kidneys are dense networks of tiny blood vessels, and when those vessels are inflamed or clogged, kidney function suffers. Supporting the heart and circulation indirectly protects the kidneys as well. Clinical research backs this up. In a controlled study involving adults with metabolic syndrome, regular pear consumption was associated with reductions in pulse pressure, a marker strongly linked to kidney decline risk. In other words, pears don't just avoid harm, they help relieve internal pressure that accelerates kidney damage. The solution here is simple and sustainable. Choose ripe pears, eat them with the skin on for maximum fiber, and use them as a reliable base fruit rather than a rare treat. This is how kidney-friendly eating becomes livable, not restrictive. But pears protect mainly through circulation, and the next fruit works through a completely different pathway, one that directly targets kidney stones, and that's where things get even more interesting. If pears work quietly by easing pressure in the blood vessels, the next fruit protects the kidneys in a far more direct and surprisingly strategic way, and that fruit is the mandarin. I've seen many people dismiss mandarins as just a snack, something tossed into a lunch bag without much thought. But for kidneys under stress, this small fruit plays a much bigger role than its size suggests. The key lies in a compound called citrate. Think of citrate as a bodyguard inside your urinary system. Its job is to bind to free calcium before calcium has a chance to pair with oxalates and form sharp crystals. And those crystals are exactly what lead to kidney stones, inflammation, and repeated stress on already weakened filters. This isn't theory, it's well established in clinical science. Citrus fruits, including mandarins, are among the most reliable natural sources of dietary citrate, which is why nephrologists often recommend citrate therapy for patients prone to stones. From a mineral standpoint, mandarins are also relatively moderate in potassium and low in oxalates, making them a safer choice when portions are kept reasonable. 2 to 3 small mandarins a day is typically well tolerated, especially when eaten whole rather than juiced. Juice concentrates sugar and potassium too quickly, while whole fruit slows absorption and adds fiber. One small habit can even enhance their benefit: leave some of the white pith intact when peeling, because that's where additional fiber and protective compounds live. This is a fruit that works quietly, consistently, and predictably, exactly what kidneys need. But as powerful as citrate protection is, the final fruit on this list does something entirely different. It doesn't just reduce damage risk, it may help activate your body's own protective defenses, and that's where the story reaches its peak. If mandarins quietly protect by preventing stones, the final fruit on this list does something far rarer and far more powerful, because it may help your body defend itself from damage in the first place. That fruit is pineapple. Many people assume tropical fruits are automatically risky, but pineapple breaks that rule in an important way. It's naturally low in potassium, which immediately makes it safer for kidneys under strain. But what truly sets pineapple apart is an enzyme called bromelain. I remember a patient who felt discouraged after giving up so many favorite foods. Pineapple became the one fruit he could enjoy without anxiety, and his labs remained stable over time. Bromelain isn't just a digestive aid, it has been studied for its anti-inflammatory effects and its potential role in supporting the body's internal repair mechanisms. Why does that matter for kidneys? Because chronic kidney damage is fueled by low-grade inflammation and harmful compounds known as advanced glycation, end products, or AGEs, which accumulate as we age and as kidney function declines. Emerging research, including a small pilot study in patients with moderate chronic kidney disease, suggests bromelain may help increase protective biological pathways that neutralize some of this inflammatory stress. While this research is still developing, the signal is promising and rare in nutrition science. The key is choosing pineapple correctly. Fresh pineapple matters. Canned and dried versions often add sugar and concentrate unwanted compounds. Even the core, which many people throw away, contains the highest concentration of bromelain and can be blended into smoothies. Pineapple doesn't promise miracles, but it offers something better: safety combined with potential protection. And when one simple choice can influence long-term kidney stress, the real question becomes this: how do you combine all these insights into a daily routine that actually keeps you off dialysis? That's what we need to talk about next. As we reach the end of this conversation, I want you to pause for a moment and recognize something important. You're here because you care about your health, and that already puts you in a stronger position than you may realize. Managing creatinine or protecting your kidneys isn't about perfection or fear. It's about awareness and steady, thoughtful choices. You don't need to eliminate everything you enjoy or overhaul your life overnight. What truly matters is learning how to reduce unnecessary stress on your kidneys, staying consistent with safer habits, and listening to the signals your body gives you through regular lab checks and medical guidance. Simple adjustments like choosing the right fruits, watching portion sizes, staying hydrated, and spacing potassium intake across the day can make a meaningful difference over time. If this video helped you see kidney health more clearly, do yourself a favor and save it so you can come back to it whenever you need a reminder or want to share it with someone you care about. And if you haven't already subscribed to the channel, and turn on notifications, because we regularly share clear evidence-based medical insights designed to help you protect your kidneys, understand your lab numbers, and make smarter health decisions without confusion or fear. My goal is to make complex medical information simple, practical, and empowering, especially for seniors who deserve clarity, not overwhelm. Remember this: high creatinine is not a verdict, and kidney decline is not a foregone conclusion. With the right knowledge, the right support, and small daily choices, many people are able to slow progression, stabilize their numbers, and preserve their independence far longer than they expect. You are not alone in this journey, and you are not out of options. Stay curious, stay informed, take care of your kidneys one step at a time, and I'll be here to guide you with the latest, most reliable information every step of the way.